Welcome to Healthy Living. I'm Aisha Salihu. On today's edition of the program, we'll take a look at the human immunodeficiency virus, acquired immunodeficiency syndrome, better known as HIV and AIDS. HIV causes AIDS, and this interferes with the body's ability to fight infections. The virus can be transmitted through contact with infected blood, semen, or vaginal fluids. Within a few weeks of HIV infection, flu-like symptoms such as fever, sore throat, and fatigue can occur, although the disease is usually asymptomatic until it progresses to AIDS. AIDS symptoms include weight loss, fever or night sweats, fatigue, and recurrent infections. It is widely known that no cure exists for AIDS, but strict adherence to antiretroviral regimens can dramatically slow down the disease's progress as well as prevent secondary infections and complications. However, a recent discovery has revealed a cure for the disease. We'll discuss this tremendous discovery during the course of the program, but let's take a look at this special report on HIV and AIDS. The origin of the human immunodeficiency virus has been a subject of scientific research and debate since the virus was identified in the 1980s. There is now a wealth of evidence on how, when, and where HIV first began to cause illness in humans. HIV, or human immune virus, is a virus that targets cells in the immune system. Over time, the immune system begins to fail, which is called immunodeficiency, and this increases the risk of infections and tumors that a healthy immune system would usually be able to fend off. These complications are referred to as AIDS, or acquired immune deficiency syndrome. The first two AIDS cases in Nigeria was diagnosed in 1985 and reported in 1986 in Lagos State, one of which was a young female sex worker, aged 13 years, from one of the West African countries. Infection rates of HIV are not slowing fast enough to reach the goal of eradicating AIDS by 2030, according to a report by the United Nations Group to Fight the Disease. The report by the Joint United Nations Programme on HIV and AIDS said shortcomings in the pandemic response can also be seen in the fight against the decades-old disease. In June 2021, UNAIDS set new targets to reach by 2025, bringing HIV services to 95% of those who need them, reducing annual HIV infections to fewer than 370,000, and reducing AIDS-related deaths to fewer than 250,000 by 2025, although the report said the world is off track to meet those goals. It further highlighted 5 urgent global AIDS strategy priorities it said should be funded and implemented globally for pandemic prevention, preparedness, and response. World AIDS Day, designated every 1st December since 1988, is an international day that has been set aside to create awareness on the disease, acquired immune deficiency syndrome, which is caused by the spread of infection of the human immune virus. We're on the streets of Abuja to talk to some Nigerians about their perception of the disease.
Prior to now, if you just hear AIDS, it just means a death sentence. But with time, we've come to realize that there is a hope for people suffering from AIDS. So AIDS is now something that can be managed. And this only comes if you are able to get the required information you need and then go to the proper places where you're supposed to get the needed treatment and care. Then it can be managed. People living with HIV and AIDS now can have hope of a better life due to the advanced technology in medicine that has given them the privilege to have access to the retroviral drugs that helps them boost their system and then live a normal life like other normal people.
AIDS is something that makes people to be very, very afraid, because we know that AIDS, before we have AIDS, there should be HIV. So HIV is just a virus. Though it can be controlled, but it has no cure. And I believe anyone that is being affected with that should have drugs that can control him or her so that he can live longer. But if you don't take your drugs, I believe that is when it will now grow to AIDS. And at the process of AIDS, you cannot have any other, as in like drugs to control that. And at that stage, I believe such a person will, like say, let me say, the person will in the point of death. So that is it. That is why people are afraid of it.
AIDS, before now, was, in fact, when you hear about AIDS, it's like a death sentence. People were scared of it, and when people are when they contract AIDS, it's as if your end has come. But with the awareness of NACA, FACA, and all that now, people are now beginning to know that even if you contract AIDS, it's not a death sentence. That you can have AIDS and live for a long time, depending on the way somebody is being taken care of, like by provision of their treatments, and also good living by eating good foods and living a good life.
There have been a lot of education about AIDS since a long time, and ever since then I've been well educated. Whenever I hear HIV, what comes to my mind is a sickness that can be cured. It's a sickness that you can stay with and manage it till when you finally get your real healing. So it's not a death sentence. It's a sickness that you can manage it. If you handle it properly, you will live longer more than people who are not even sick.
Efforts to combat the disease is underway as international organizations, government, and other private individuals contribute their intervention quota towards ending AIDS as a public health threat, with Nigeria launching a 62.1 billion naira HIV trust fund for persons living with HIV and AIDS in the country. This would help reduce the funding gap and also place more people living with HIV on treatment. About $6.2 billion has been spent on HIV response in Nigeria. About 80% of the funds were contributed by external donors, mainly the U.S. AIDS Relief and the Global Fund to fight AIDS, tuberculosis, and malaria. The private sector contributed 0.1% to 2% of total funds, with the rest of funds provided by the Nigerian government. Launching the trust fund, President Muhammadu Buhari said at the last United Nations General Assembly high-level meeting on HIV and AIDS, he called for a renewed global action to address the HIV and AIDS epidemic in Africa, noting that ending AIDS as a public health threat in Nigeria will require increased domestic funding.
We have continued to make good our commitment of placing more people living with HIV on treatment annually using national resources. However, strong domestic resources mobilization with an enduring partnership and shared responsibility is required to sustain the response to HIV and other emerging public health emergencies. Our purposeful partnership with the private sector in our response to coronavirus pandemic provide a readily available financing solution that we can leverage on to sustain the HIV response.
He commended the National Agency for the Control of AIDS and the Nigeria Business Coalition Against AIDS for their efforts in establishing the HIV Trust Fund of Nigeria to secure a generation of babies free of HIV. Secretary to the Government of the Federation, Bas Mustafa, said the launch will guarantee funding from the private sector-led resources for HIV interventions, especially for the elimination of the mother-to-child transmission of the virus.
The establishment of a private sector-led coalition against COVID-19, CAR-COVID, clearly demonstrates private sector's renewed commitment to support national response to emergencies and pandemics.
Today marks an important milestone in building a coherent strategy for private sector engagement against HIV/AIDS. As we launch this fund, I am reminded that we have about 2 million of our compatriots living with HIV/AIDS. And it is our collective responsibility to bring this number down to 0. We have heard what the problem is, what the facts are, and the rationale for the HIV Trust Fund of Nigeria. I don't need to go over them. My job is to encourage all of us to contribute to this $100 million fund that will be led by our very able Dr. Chikwe Ozemene.
Also speaking, the Director General of National Agency for the Control of AIDS, Dr. Gambo Aliyu, said within the last 3 years, the agency has identified and placed on treatment an additional 900,000 persons living with HIV, bringing the total number of Nigerians on HIV treatment to 1.7 million. The Director General, while justifying the need for the fund, said providing lifelong treatment to all persons living with HIV, even after successfully stopping new HIV infections, would require a domestically sustainable financing mechanism. The National Agency for the Control of AIDS in Nigeria says there is the availability of modern facilities to combat the disease among key population transmission. Also, the Society for Family Health and Intervention Organization highlights their core achievements in the collaboration with a network of persons living with HIV and AIDS.
There are devices for prevention newly launched and now they are tested across the globe. There are devices for testing and there are new treatment modalities. They are all out there. Prominent among is the HIV self-testing. These are devices that provide individual opportunity to test themselves to know their HIV status at the comfort of their rooms. Sit down in your room, use your body fluid, saliva in particular, test yourself to know whether you have HIV. Within 20 minutes, 15 to 20 minutes, the result is out. You can read it and you can also interpret it given the guide that is provided that come with the test. In terms of new mode of treatment, apart from what we do now conventionally where we give patients living with HIV drugs of multiple months, we call it multi-month dispensing. When they go, we don't see them until after 3 months, and that gives them significant break in terms of them frequenting hospital every month to take medication. So that one we're doing already. But one thing that has come up now and is practiced somewhere is the injectable HIV drugs. The injectable HIV drugs are drugs that are given every 2 months, and now it is looking like it's possible to give every 3 months. In a year, meaning someone will show up at the clinic and take this injection like 4 times or 6 times, and that's all. And this is especially convenient for patients that feel uncomfortable taking pills every day, or that find it very, very difficult to adhere to the regimen of taking this drug on daily basis. They can have this injection, and after 2 months they can come for another one, or after 3 months they can come for another one, depending on the interval, spacing interval. So this is something that was not there before, and now is there. And with time we're looking at probably expanding that spacing interval to up to 6 months. So you'll be looking at someone come in to take this medication only twice in a year. Come after 6 months, come for the next injection, and they are done. And the virus will be very well suppressed in them. It hasn't commenced in Nigeria, as with drugs that are newly launched and devices that are very recent. The cost is prohibitive at the beginning, but with time, more donation comes in and more subsidies are provided. The cost crash and come down. We are hoping in a year from now, such new technologies should be available here, and people who want to benefit from them.
Yeah, Nigeria is really committed towards ending AIDS by 2030. And under the leadership of the new DG of NACA, Dr. Liu Gambo, we have real, well-structured and tailored strategies to end AIDS by, 2030. For example, in 2020 alone, Nigeria was able to ensure that over 8.5% were tested and knew their status. We also ensured that that in 2020, like I said before, we have about 1.6 million people already on treatment. So that is actually we are on the right trajectory to ensure that we end AIDS by 2030. So Nigeria definitely will meet the Sustainable Development Goal of ending AIDS by 2030. Yeah, we do understand that stigma and discrimination is actually a major drawback. And good enough, Nigeria actually has a law that actually says that you shouldn't stigmatize people that have, and we have an anti-stigma law that has been passed by the National Assembly. And so with the law in place, I guess the challenge, like most laws, it's its implementation. But working with NACA and other international bodies, we are trying to ensure that people are not stigmatized. We keep telling people HIV is no longer a death sentence. So once you know your status, there are drugs that you can take, life-saving medicines that will make you live like a normal person. So it's really working very strong. Recently, we just did a survey that tries to measure stigma among people living with HIV and AIDS. The figures are not looking too well, but with interventions in place, we are likely to ensure that stigma and discrimination is no longer a major factor that deterred people from either knowing their status or coming to being on treatment as far as HIV is concerned. Unfortunately, we aren't doing too well as far as mother-to-child transmission is concerned. The data released as at 2020, I think PMC coverage in Nigeria was about 94,000, and that is not really nice. And we're surprised that we still contribute over 10%, 30% of the global burden as far as PMC is concerned. And that is, a bit of a challenge. But I know there are a lot of efforts, both by the Federal Ministry of Health and NACA, to ensure that we change that statistics that is not really helping us globally. I guess we have all the tools, we have all what it takes to ensure that that is not our case, because other countries have been able to eradicate, mother-to-child transmission, and so why not in Nigeria? I guess without boring you with the medical jargons, the challenge is we've actually had looked at waiting for the mothers to come to health facilities to ensure that they access services from health facilities. But we're beginning to see that will not help. So we are taking the health facilities to the community and ensuring that we test people, we test pregnant women. They know their status whilst they are pregnant, and also want to ensure that even whilst in the community, they also enrolled and make sure they're on treatment. I guess my simple message to Nigerians is go know your status, which is quite key because it's the beginning. And so whichever way the pendulum swings, if you're positive, there are drugs, life-saving drugs for you. And we have a lot of support to ensure that you have access to those medicines and you live a normal life. And if you're negative, it means, you need to keep practicing those behaviors that will make you stay negative. And so we also want to encourage people that, it's no longer a death sentence. There is always a way out, whichever way the pendulum swings. I guess generally, pandemic preparedness is becoming quite key as far as Nigeria is concerned. So it's also important. I think one important information for you to know is that globally, Nigeria is one of the very few countries that didn't, drop in terms of number of persons on treatment during COVID. And that is quite, commendable, because other countries, because of COVID, they actually had a drop in number of persons, that were placed on treatment. But because of the strategies Nigeria put in place, we ensure to ensure that, we sustained and surpassed our target in terms of number of persons that should be on treatment. So it's becoming a twin pandemic, COVID and HIV. I guess we probably would see how we can make the best of the opportunities and ensure that people have access to services and they live the life that will make them stay healthy.
We'll take a quick break now. The program continues shortly. Welcome back. If you're just joining in, this is Healthy Living. Still in line with the HIV and AIDS intervention in Nigeria, experts says the disease is better managed now in the country.
Compared to what it used to be around 80s, HIV is well managed now in the country, Nigeria, and worldwide. When you talk about management, once a patient is positive, and let me put something clear here, it's not cure, it's management, just as you said. There's really no cure for now. What we have is, once somebody is positive, we start the person straight on HIV drugs. Based on the national HIV treatment and prevention guidelines, somebody has to go through testing, counseling and testing. You counsel the patient first. If he's negative, you counsel him on how to stay negative forever. If he's positive, you counsel him on the fact that he's positive. Then you now refer the patient to where the person can access treatment or management. And we usually will have HIV drugs based on the national guideline. Of course, when they come, there are some basic vital investigations that we do, but because we are practicing test and start, we make sure they start immediately. Once we discover they are positive, we start immediately based on test and start principles that we are using. So we involve, based on the investigation, we know whether the particular combination of drugs that they will be on. And usually it's the first line drug that they start with.
Now, moving on to newer discoveries, Oxford researchers have announced the discovery of a highly virulent strain of the HIV that has been lurking in the Netherlands for decades. But because of the effectiveness of modern treatments, there is no cause for alarm. Their analysis published in the journal Science showed that patients infected with what they call the VB variant had 3.5 to 5.5 times higher levels of the virus in their blood than those infected with other variants, as well as a more rapidly fading immune system. However, the study also found that after starting treatment, individuals with the VB variant had similar immune system recovery and survival to individuals with other HIV variants. The variant likely arose in the late 1980s and early 1990s in the Netherlands, according to the researchers, but began to decline around 2010. The VB variant, however, was found to have over 500 mutations. And to some exciting discovery, a woman of mixed race has been cured of HIV in the United States, the New York Times reports. She is believed to be the third person ever to be cured of the disease. According to scientists, the woman who had leukemia received a stem cell transplant from a donor and was cured with a new method involving umbilical cord blood that opens up the possibility of curing more people of diverse racial backgrounds than was previously possible. Cord blood is more widely available than the adult stem cells typically used in bone marrow transplants and does not need to be marked as closely to the recipient, the Times reported. To stem the HIV and AIDS tide, it is advised that you know your HIV status and avoid risky behaviors. Take an HIV test today. Thanks for staying with us on Healthy Living. Till I come your way on another edition of the program, I'm Aisha Salihu. Bye for now.